Welcome to the Healers Café, conversations on health and healing with Dr. Manon.
So welcome everyone to the Healers Café. Today's guest is Annie Boerner, and I'm really thrilled to have a conversation with her on how everything began for her, and also all the gems that she has learned over the years she's been in practice. So reading just a short bio, she's an integrative health practitioner specializing in calming and rebalancing techniques of the whole person through the nervous system. Beginning her career as a neurological therapist, she then pursued licensing in bodywork and integrative therapies at the National University of Health Sciences in Lombard, Illinois, and additionally has received Bowen training also in the UK and Switzerland. And I understand that you have a specialty in treating pain, anxiety, PTSD, chronic illness, etc. So welcome. And why don't you jump right in? How did all this start for you? How did you know? Did you wake up one day and realize, you're a therapist, or you're a healer?
Thank you so much for having me. I'm really excited to be here. Well, my journey began, I always had an interest in how the body worked, and I was a professional dancer when I was at high school, college years, those ages. And so I thought I might want to become a sports med surgeon when my dancing career was over. I was very fascinated. I loved watching how the body moved and worked and everything. So that was always a fascination for me. And then eventually I got married and had my first child, and he sustained a pharmaceutical brain injury. And so it was in my efforts to help him, because it was in 24 hours that we saw the effects. And I knew, okay, he didn't come this way. So I need to figure out what to do to help him get better. And so I just began researching like crazy. And it was through the years of finding different therapies for him and learning what was working that I began to see the nervous system is really, really key in how things were being carried out in the body. And so I began there and got into neurological therapy, got trained and began that. And then I started seeing how everything emotion and trauma and all of those things they stay in the body, and that really attending to the body and the hands-on work was another crucial piece of the puzzle. And so it was very serendipitous. I ended up at a school where my clinician was a chiropractor who was I didn't know it at the time, but she was just using rather than high velocity manipulation of bones, she was actually using Bowen on her patients, and wow. Was one of them. And I went from having low back injury for 20 years to it being gone, and I didn't have low back pain anymore. And so that began that journey, and it's been a wild, wonderful ride ever since.
Wow. So first it starts like, it's funny because part of, what I've come to realize of being in practice is that there's usually somebody self-identified, that says it's my calling, it's my responsibility, or it's, I need to do this. And yes. When you have a child, there's no choice. It is your calling, right? Like, what do you do in a case like that? So, exactly. So what, I, again, share what you want to in this, but what actually happened, and how did you know that there was something wrong? How, because a lot of people don't, they don't know, and then they see their GPs and they say, oh, no, this is normal. And it's like, it's, it's not. But so help us sort of understand your process and your kind of awakening to something's not right.
Something's not right. Absolutely. So with my son, Tom, it was very clear because he was very bright-eyed and very talkative. So at 12 months of age, he had 80 to 100 words that he have a vocabulary. So he couldn't put words together or anything like that, but he could point and say what he knew. And his words were very clear. And so after his 1 year checkup, and they gave vaccines, in 24 hours, he went from being bright and everything was great to 24 hours later, he couldn't speak. When he would try to speak, he would say, I mean, that was all he could get out. And he was screaming and banging his head in the wall. And it was overnight. And so there was clearly something wrong. The doctors at the time were trying to say, oh, he's probably got ear infections, or he's got this, or he's having a headache, or, and so what I've learned later, and the reason that I refer to it as pharmaceutical brain injury, is for a couple of reasons, because that's truly what it was. He had too much. It was just too much all at once. They gave me Pitocin for his labor. And at the time, I was just blindly trusting everything the doctors did. And so what I found out in retrospect was that they had me on the highest amount they could give me, and they left me on there for 14 hours. So both Tom and I were mercury poisoned by the time he was born from that. And then add to that, by the time he reached 12 months, he had been given 19 vaccinations as an infant. I mean, that's insane. I'm not sure an adult could sustain that in a healthy way. But that was, he's 22 now, and he was born in California, and at the time they had accelerated the vaccine schedule. I think probably without a lot of testing up on that ahead of time, maybe, I don't know. And so I don't know that it's the same now. I think more and more parents are informed and going, no, let's spread this out. Let's not do things the way we have been, But I really believe that all of these things happen for a reason, and that it's really been my mission to learn all these things so that I can help other people. And so I began looking for answers, and initially it was just a lot of different therapies and things to help him to get better. And then I learned about energy medicine and bio detoxification, just using energy medicine and frequencies. And when we found that, he was back to normal within 5 days, and it was without healing crisis, and it was just incredible. And
Wow.
At that moment, I went, when you see your child fall into an abyss and you get them back, okay, everyone deserves this. And it became my mission in that moment. I have to help other people, and I don't know how I'm going to do it, but I have to find out. And that was what sent me into school.
Wow. So because, there's a very different audience listening to this, and there's energy medicine. Sometimes they everything is energy medicine,
True. So it's important to define that.
Yeah, let's define it a little bit. And then 5 days, you mean from the onset of his state, or you discovered all this later, or what's the timeline? And tell us really how he got better with this.
Yes. Okay. So he was okay. We kind of went along, and we did occupational therapy and speech therapy when he was, that began at age 2. And then we did that for a couple of years. At 4, he was prayed over and instantly got his speech back. And so, but he was still very much on the autism spectrum at that time, but he was able to talk. But nothing else, everything else was still he was able to, he is fully recovered now. So he was able to explain when he was older what he was going through. He was experiencing hallucinations, just his mind racing, his body, all of his senses were really messed up. Like the sound of the ceiling fan running, which you and I probably wouldn't really hear, was painful to him, but he could bang his head and have a goose egg and didn't really feel that, you know, so everything was sort of backwards and, which is referred to as sensory integration dysfunction. So there were a lot of things that the occupational therapy was able to help. And so things got a little bit better and a little bit better. And then when I learned about the type of energy medicine I'm referring to is using frequencies. And basically there was some equipment. We would put your feet on this equipment and it would give your body, it would show your body the frequency of mercury, for example, or aluminum or something, some kind of a toxin. And then your body would be able to let it go, like let the cells would go, oh, wait, okay, I know that shouldn't be here. So the way that it was explained to me was that everything gets very overburdened in the body. And then your body's just holding on to everything for dear life, even the things that it shouldn't have. And so if you can communicate in that way through frequency, then the cells can actually let go of, because they recognize the mercury doesn't belong in there, or the aluminum doesn't belong in there, and let it go. And then, so it was a series of doing those sorts of treatments along with far infrared saunas and ionic foot baths and things like that. And it's interesting because you hear things in online about, oh, that's a scam or that's a scam. Well, I'm here to tell you. And I think using the frequencies prior to doing those sorts of exit strategies for the body are what made the huge difference, because even his eye color and his hair color changed in 5 days. Wow. He has blue eyes, and they had gotten very kind of dark and ashy and gray looking, and his hair was sort of a golden brown, and then it had gotten ashy also. And by the end of the week, it was back to the color that it had been when he was a year old.
Did you think of taking pictures? I mean, it's like, it's always later that you wish.
I know, I did. Well, and it was funny because I was with him and I was actually going through that detoxification at the same time, because I was I was a mess. I was probably just as bad off as him in certain ways. And I didn't even recognize the hair color changing and the eye color changing. It was actually when we got back to Illinois, and we walked in and saw my mom and my dad with my 2 other kids. And the first thing out of my mom's mouth was, look at his hair. Oh my gosh, you know? So, cause I was probably seeing the change gradually, so I wasn't recognizing it straight away. But up to that point, he had only been able to monologue. And by Wednesday, the 3rd day of treatment, he could have a conversation and actually like listen for a reply and then respond appropriately. And that was not something he'd been able to do before. So yeah, that was really life-changing. Beyond that, there was certainly other things that, you know, as time goes on and as I learned things, I learned that I'd been living with PTSD for probably 25 years and didn't know it. And that's a whole nother thing. But when I learned that and started getting the help that I needed and really working toward reintegration of myself, I was able to actually identify in him trauma response that was really looping and creating other things going on in him. And so then that was where, you know, Bowen work was huge. I mean, that was just such an enormous piece of the puzzle to help with that as well. So it was the combination of all of these things together.
And often, you know, we don't know, right? It's like, you know, you have to start with something. And then, you know, I always tell my patients, if it works, keep it. If it doesn't, you know, change it, right? Like we have to be patient a little bit, you know, let's say you take supplements. You might not have an immediate thing unless it's a screaming, you know, deficiency. It takes a bit of time, but so many of these therapies are really quick, you know, and I know with Bowen Therapy, it's often like right there and then on the table, but certainly by the 3rd visit, you're changed. You know, there's no it's not like maybe they're changed, maybe a little bit. It's like, no, this is,
Yeah.
absolutely clear, so, and with homeopathy too. But before we go into the trauma, um, when you're mentioning with the frequency, it made me think a bit about homeopathy, how,
Mhm.
and really like the idea behind a vaccination is the idea of giving a little bit of the same to
Yes.
mount a reaction, right? I mean, in fact, the whole concept was started by a homeopath, right?
Mhm. Yep. So it's
So the idea of, inoculating is, it sounds sound. I think when you call it pharmaceutical, toxicology, or what was your exact term? I can't remember, but
brain injury. Yeah.
it's an injury because it's an overdose, mismanaged, and you look at the amounts. Like I was looking at how much Canada, how much we give children in Canada now compared to 10 years ago, compared to 30 years ago,
Mhm.
massively increased. In
Yeah.
the States, it's 5 times as much.
Mhm.
You look at other countries in Europe and it's less than it is in Canada, and it's like, wow, where's the science? Like, there's no way that our bodies are so different. Yes, we're individual. We
Right.
have to pay attention, but like, to make this a normative type of behavior. And then, now, like in California, we have, like, people have no choice, right? They have to vaccinate. It's mandatory. And, it's an interesting question, that I have. I'm not giving an opinion on it per se, because in fact, in our profession, we're not allowed to. So as a naturopathic physician, we have to go with what our governing policy is on public safety. My question is, let's talk about this a little bit more. Let's find out, not like, that it causes this or does that. Like, it's just like, why are there such massive differences? And the idea of science is it's based on, reproducible, similar things, and there's nothing similar,
Right.
Anyway, I digress, but
I'm with you.
but as far as the similarity, then it sounds like, and correct me or educate me further with this frequency. So it's like the body recognizes a sameness
Mhm.
and then wants to eliminate, which is the like cures like. I mean, it sounds like it's very much.
Absolutely. And I think that, when it's applying that same principle that Bowen applies to the body,
Mhm.
which is, it's not forceful. You're simply presenting to the body and you're allowing the body to have its process. So it's safe, and I find much more effective, the different modalities that it's funny because I didn't really understand that ahead of time, but in the
Mhm.
end, I ended up being drawn to just the few modalities that I work with. They are all the same in that respect. And I just feel that is where the best results happen. And the
Mhm.
reason that we don't, if we're going to force something, there's, there may be some kickback if the body's trying to protect itself in another way. Um, and so, but that is, we're giving the body information to work with.
Mhm. Correct. Yeah. So let's jump then to, because that's really been your specialty, anxiety, trauma, PTSD. Yeah, tell us what you can from your perspective, your experience, and so
Okay.
that people who might have this also go, wow, there are other solutions out there.
Yes, absolutely. And I think, and I'll preface what I'm going to talk about too with just reiterating what you said. I wholeheartedly agree. It comes back to, there isn't one perfect modality that's the fix for anything. I think it's the combination of the things that everyone needs. And I have found that Bowen work tends to be the big missing piece for so many people, that it just cannot be left out of the picture. But anyway, so I went through something that when I was 19 that lasted a few days, and I disassociated from the whole event. And so I just had no memory for a long, long time. What was interesting was after my first session of Bowen work, after receiving it for the first time, about 3 days later, I started having flashbacks of what happened. And initially I thought, oh my gosh, I'm going to be like in a heap in the corner or something, you know, not able to function. But it wasn't like that. It was very gentle. Another thing that I learned through, you know, that process, but also my years of training and practice, was that the subconscious mind is so amazingly designed to really only allow things to come through when the right supports are in place and we're ready. And so I did have the right supports in place, and even though I wasn't really aware of it. And so when I reached out for help to the people that I was working with, and then it was amazing to find out how much trauma is stored in the physical body, and what a great piece of the puzzle that was. And I kept being led to, like, you know, different things, but certainly the Bowen work was it was huge. In allowing my nervous system to find its way, with being able to not stay, but get better and better at auto-regulating, and, you know, staying in a better state overall. And it was a process, because there was a lot to sift through. So it was a process over time, and finding counseling and things like that to help me really unpack everything emotionally and mentally, as well as physically. And so that's what I love helping people with now. One of the things that I see trending in my practice, and what I hear people speaking about a lot, is anxiety. And that basically, I refer to that as being hijacked by your nervous system. And that, you know, there are triggers that can be, you know, created, it's your subconscious's way of trying, and your brain's way of also, I mean, those are two different things, of trying to help you survive whatever the conflict was then, but also, you know, if it hits that, if you experience whatever a trigger might be, then the brain thinks you're still you're re-experiencing this all over again, even when you aren't. And so being able to identify that and help people to see those things. I also did training to do EMDR, which is eye movement desensitization rebalancing, I think. Is that what that stands for? I thought I was right. Now I'm on an interview, I'll mess it up. But that has been a game changer for so many people. And it's so simple, and it's quick, and you don't have to remember whatever the event was. You don't even have to know what it was, and it still works. But that it's combining things with Bowen. So there's other little things that I have learned to implement in the practice. But it's the combination of all of that together that is really life-changing for people.
Yeah. So I'd be very curious, because I mean, the work you're doing is very similar to, and my specialty was trauma as well, which is very interesting. And I'm actually doing a TEDx talk on this very subject, right? So I'm going to put you on the spot, but I would love to know, how would you explain, and you know, you don't have to you can do it scientifically, but how do you explain to people who say, you know, like basically it was in your body, you did not know it, you did Bowen therapy and other things at different points, so I'm getting that, but still the Bowen therapy brought it out gently. It gave you what you could handle. Like, that's all things I've witnessed too. It's just, you never get what you can't handle. And anyway, we can go into that, but how does that work? How does it happen? Do you have a theory of how that happens?
I do have a theory. I have no idea if it's really accurate, but it feels like it is. So this is how I explain it to my clients. From what I've observed and from the research that I've tried to find and read from every direction I can, it appears that our thoughts, our emotions, our spiritual self, and our physical body, they're all inextricably interwoven. You know, you can't just separate your emotion from your body or, you know, anything else. You know, it's all woven together. And it appears that those parts of us all come together and touch each other through the nervous system in the physical body. If that's actual fact, I don't know, but that is what it appears to be. So that is the theory that I go with. And so the way that Bowen is working, you know, we're giving this very gentle input to, you know, through to the body, or to the nervous system through the body, through the connective tissue. We're communicating with movement with those neuroreceptors, that their job is to help deeply down tune and relax the nervous system, get it into that parasympathetic state where it can begin rebalancing. So, and we watch how, you know, clinically we see that all the different systems of the body are given that opportunity. You know, you can have your lymphatic system can get a nice, you know, gentle flush, and your endocrine system has the opportunity, like all those different systems have the opportunity to rebalance. And of course, our nervous system is only going to carry out what makes sense and is safe and is needed and all of that, because we're just kind of like presenting the body with information and allowing it its process. But in that same way, when the physical body is being given that opportunity to rebalance, so is your emotional being and your thoughts and your spirit of all those parts of you are getting that same opportunity. And again, the subconscious, you know, we think of the mind and the brain, and not everybody, I don't know that we always talk about those being two different things. You know, I see the mind as being very complex and amazing, and 90%, I think it's widely accepted, 90% of the mind is subconscious, only 10% is conscious. And then the brain that's communicating to the brain, which is sort of the hard drive, the computer, right, that's carrying things out through the body. And so there's certainly some deep programming in there, survival mechanisms that are hardwired in that, you know, so when we experience certain things emotionally or in our thoughts or, you know, in our environment, that can trigger that survival response in the body. And so if it can go that way, it can also unwind the other direction as well, I think.
Yeah, no, it's you know, I too have done a fair amount of reading, and I don't think I've come across something I say that's the absolute why, but I think it is the interconnectivity and the fact that we do tell the body that the emergency is over. And it's the parasympathetic state that allows us to restore and repair. You know, and now that we understand that the fascia has all these, you know, free nerve endings, it is a super highway of communication, right? So I feel like, you know, and like you said so well, all the different organs now get to do what they're supposed to do, you know. And I was just thinking, this is nothing to do with trauma, but I was thinking of a patient who had osteoarthritis of the knee, and it was incredible to see, you know, it's like literally when he got into parasympathetic, because he had an associated angst about this, right? Because it was a traumatic experience. In that sense, it's trauma. Once we relaxed him, it's like all the microcirculation was able to get to the joint and give the nourishment necessary, and the lymphatic system was able to pull away the debris, right? So, and that's like structural functional, you know, but when we talk about like deep-seated disassociations yet stored in our body, you know, it's harder to understand it, you know, but it's I feel like it's not a mechanism like circulation that changes. How, and that's the, how does it actually come to express, you know, like, yes, the nervous system, parasympathetic, but why is it that and you know, I know why is not always the question to ask, but I was born with the word why in my mouth.
You and me both.
You know, but it's like, you know, why? And it's funny, I worked for a while with a hypnotherapist, you know, in my clinic, and he says, oh yeah, we work with the subconscious, and you know, we put you in a very relaxed state, and we would see, like, clearly people would bring up things safely that it felt it was the right time. And then we did experiments together where I did Bowen Therapy, literally touching the body, and it was like, yeah, he felt it was hypnotherapy on steroids, you know. It's like it felt like, and I shouldn't be saying steroids because I got my opinion on that too, but it's more like, how does the body so magically, seemingly just release when it knows it's safe, or when it's in, you know, it's like, you know, I can only think it's got to be that response, you know, like you said so clearly, you know, we're in this fight, flight, fright, we're in this survival mode, and then we're not anymore.
Yeah.
Right. And then it's like, I don't know, we're programmed to heal. That's all I can think of.
Yeah,
you know?
I think it's just how we're made. You know? So when you remove, and that's another way that I explain Bowen to people who are unfamiliar with it, it's we're removing burden and restriction. And when you do that, the body heals, because that's what it's designed to do. Like, it just heals. It's just innate. You know, we have to get the load off, so to speak.
Yeah. Yeah, and I do think that's you know, a lot of pain, and a lot of all of that is constricted energy flow in the body, right?
Yes.
You know. Yeah. So tell us, like, I don't know, one of your most exciting Bowen Therapy cases, something that just like shocked you, because there's, you know, so many things, but tell us something.
That's true. Okay, the one that shocked me was a woman who came to me with back pain, low back pain, and it was actually more in her hip. It was she, you know, she did have some low back pain, but it was more one hip that was always bothering her. And she happened to be type 1 diabetic. She had childhood onset diabetes, and she was in her 40s at the time that when she first came to see me. And she was very good at taking care of herself, and very diligent about keeping track of her blood sugar and her numbers. And she really monitored everything very carefully, because she was aware that, you know, what the risks were for her diagnosis, and things, you know, that could happen if she didn't take care of herself. So she was really great about that, and very proactive. And so anyway, I'm treating her for this hip and low back pain, and she felt wonderful after the first session, and she came back for the second session, and she said, I just can't even. Oh, and she had some neuropathy too, on the tops of one foot, where she couldn't even keep her foot under the covers in bed. She would have to have her foot on top of the covers, because it just hurt to have anything touch. And so she came back the next week for her second session, and she said, I can't believe this. She said, that's 90%. She said, my physical pain is 90% gone. And she said, I've done everything, and nothing has worked like this. And I said, well, that's wonderful, you know. And I'm thinking, well, that's what I was expecting. So,
right.
You know,
back pain, yep.
right, you know. So I thought, okay, great. And she said, and by the way, she said, my blood sugar remained level the whole week. She said, that's never happened before. And she said, was that to do with this? And I said, it could be. And so, and because her pelvis was very out of balance, and therefore so were her cranial bones. And so that was something that, you know, we really paid attention to, because, as you know, and I'll just say this for anybody unfamiliar who may be watching. So the brain has to keep the eyes level at all costs. So, you know, if the pelvis goes out of alignment, then, you know, the spine and everything else is going to make those little adjustments to make sure that we keep the eyes level and so on. So, but part of the input that the pituitary gland needs is for those cranial bones to be properly aligned, and for a certain amount of like a tapping that this one bone does on the pituitary gland. I'm trying to really keep this concise.
No, it's good. But explain it. I think it's really good to get this, you know, and why sometimes the structural, you know, impact can actually free a hormonal issue. So
exactly. And I hadn't even thought of this. And so, because the pituitary gland is actually sitting in the sphenoid bone, which is behind the eyes. So as that leveled out, when things realigned for her, then all of a sudden she had the proper articulation of that sphenoid bone. So then the pituitary gland was now getting the proper input. And it helped that's sort of the master overseer of the endocrine system, one of them. And so that was helping. So after her second session, she came back and said, okay, pain is completely gone. And I had to call my doctor to decrease my insulin. She said, I'm 43. Like, I've been giving myself shots for years. She said, I don't understand what is happening. And like, he would love to talk to you. I said, sure, I would love to talk to him. And so I said, as long as you're working closely with him, then do whatever you need to do, you know, in his care. And so after the third session, she called me to tell me she was off her insulin. And he was, I'm sure in his busyness with his practice, he didn't call me, so I never actually connected with her endocrinologist. But yeah, that was shocking to me. And I just thought, wow, I mean, certainly, you know, I'm telling this story and not suggesting that every case of diabetes could be fixed with Bowen. However, in her case, it was very mechanical. It was a structural misalignment that was causing a huge problem for her hormone balance. And in particular, her insulin production and regulation. So, I mean, you just never know. There's so many things that when we restore all of that, the proper alignment and fluid movement and all of those things, that it's amazing what the body can do with it.
And I think, you know, you've said this, but I'm just pulling it out again. It's structural, but it's not as if Bowen Therapy pushes things into place or massage or rubs things, you know, into order, or forces, you know, a muscle to do a thing that we believe it should be doing, right? It unleashes everything. It allows the body to, you know, like to get back in order so that everything sits properly in the brain, basically, you know, and circulation, right? And nourishment. And, you know, so it's really a profound working with the body, you know, it's, that's a great story.
It's wild. Yeah.
Oh, wow. Anyway, so, this has been great. I could go on and on, but
it has been. Thank you so much for having me.
Yeah. Okay. Well, I will have your details so people can get hold of you, and of course they can also get hold of you at Bowen College, because you will be teaching in the States. So I really look forward to getting this work out in a huge way, because it's really not known the way it should be, you know. And you think the I can't speak anymore. How come my brain doesn't work anymore?
End result?
No. The hormone guy. I can't even say
Oh,
it.
endocrinologist. Sorry.
Endocrinologist.
You and me both.
Blank. Try. Don't force. Trust. Anyway, but you think like, okay, why aren't they following up this kind of thing? And you can never say, oh, an individual, everyone's crazy busy, but we have a crazy system that doesn't follow up or ask enough questions
Yes.
to see what else worked, and don't get me going, I got lots on that, but
Yes, I know. It's puzzling.
it's puzzling.
I've met doctors and other people in allopathic medicine who were very against everything, which I understand that, that's what they're learning. It's where they're coming from. It's what they're taught. I get it. But I've met so many in my area here in Nashville that are just so ready to team up with all of us in, the alternative health practices and things. And so that's been very encouraging.
Yeah, well, we're definitely,
so many people joining forces.
Yeah, we're definitely in a new re-understanding of, holism. You can't separate and divide. We need to work together, and because the body is together, right? It's like,
sure is. Yeah.
Anyway, thank you so much, and we'll be in touch.
It was wonderful to be with you. Thank you again.
Thank you for joining us at the Healers Café with Dr. Manon. For more information, go to drmanonbollinger.com.